Hi, this is Mrs. Main, and I am going to be posting 4 of these recordings, chapters 42A, 42B, 43A, and 43B. Please feel free to take notes. I have also posted the traditional PowerPoints with my notes included as well on Blackboard. Thank you. So today I am going to be talking about nursing care of the child with an alteration in bowel elimination and or a gastrointestinal disorder. Please review and be familiar with the anatomy and physiology of the gastrointestinal system in children. You need to know the function and role each will play in the GI system and know what the differences are between an adult and an infant and a child. Also, if there's a word that's highlighted in blue and you're not familiar with it, such as regurgitation or dysphagia, you will want to look these up and be familiar with them. So first off, in gastrointestinal and elimination, you need to be aware of fluid balance and losses. Compared with adults, children exhibit differences in how fluid volume is maintained. These differences are evident in body fluid balance and in insensible fluid losses. So, an insensible fluid loss, we'll start with, is something that's difficult to measure. You may not be able to see the fluid being lost as you would see in a body fluid loss. So, insensible fluid loss, for example, a fever would increase your fluid loss at about 7 milliliters per kilogram every 24-hour period. For every 1 degree Celsius, the body rises in temperature. So if you have a 10 kilogram child and they're running a fever that is 1 degree Celsius above normal, you would anticipate that they're going to lose 70 milliliters in a 24-hour period above their normal fluid loss. Also, about 2/3 of insensible fluid loss occurs through the skin. Infants, in particular, are at a greater risk for fluid loss than an older child or an adult because they have a larger body surface area ratio to body mass. So as they lose 2/3 of fluid, it is going to be a larger amount in proportion to what an adult would be losing. In body fluid loss, stuff that can be measured, infants and young children require a larger relative fluid intake than adults. And again, this is in percentages. And infants and young children are going to excrete a greater amount of fluid than an adult, again, in percentages. So if a 3-month-old excretes 100 milliliters of urine in 24 hours versus an adult excreting 100 milliliters of urine, you see that there is a much larger difference in their percentage. So this places infants up to 2-year-olds at a much greater risk for fluid loss than the older child and adult. So, nursing process, child with the alteration of bowel elimination and GI disorder. No matter what the disorder may be, it's not going to change your assessment of the child. You're going to still collect a health history. The health history should look at family history, their birth history, the mother's pregnancy history, any history of infections, complications, and then what the current complaint would be. The physical exam will start at the head. You're going to start with the mouth, examine the oral mucosa, teeth, tongue, ability to swallow. You're going to observe, inspect, and then you would want to auscultate, listen to the abdomen, listen for bowel sounds in all four quadrants, any unusual sounds, and then you would want to percuss, which is the finger tapping your other finger over areas that are not compact. You would hear a tympanic sound. Over areas such as the liver or a full bladder, you would hear a dull thud sound. And after you have done your percuss, you can palpate. You're palpating for softness, tender areas, masses, items like that. So as you've done your assessment, keep in mind a large part of that inspection and observation, you're looking at the child's color. You're going to look at their hydration status. And depending on their age, part of that hydration status would be looking at their fontanelles. Are they bulging? Are they sunken? Looking at their mucous membranes. Are they dry? Are they moist? Are they able to make tears if they're crying? What does their skin feel like? Are you able to test for turgor? Is it returning quickly to its prior position, or is it tinting? Look at the abdomen size, the shape. Is it bulging or rounded? Is it sunken? Observe, are they alert and aware of their surroundings? Are they sleeping? Are they sluggish? Are they just kind of just laying there and not very interested? All of that is part of inspection and observation. So another part of your assessment is to collect if ordered lab or assist the child in obtaining diagnostic testing. And then you would want to look at results and see what those results are telling you. In elimination and GI disorders, a lot of diagnostic tests look at the esophagus, the stomach. They look at the function of the bowels, the intestines, small, large, the rectum. They they are looking for things that are abnormal. So they look at stool specimens. How are they? How easily is the child able to eliminate stool? Are they having difficulty? Is it solid? Is it liquid? Many of those things are taken into consideration. Many labs and diagnostic tests are done off of stool specimens. In your book on box 42.1, it talks about the different age groups and how to collect stool specimens. Make sure you read through that. When is it appropriate if the child's in a diaper? How do you collect the stool out of the diaper? How do you collect stool if they're having diarrhea? Are you able to use a bedpan and things like that? It's a pretty informative little box. So you have a list of common laboratory and diagnostic tests. 42.1 talks about an abdominal ultrasound. Please take time, read through these, be familiar with what a test does, why it might be ordered, and what the nurse needs to think of. Continuing on here. So what are some potential nursing diagnoses if you have a child with an alteration in bowel elimination and GI disorders? So if they're losing fluids, they're at risk for hypovolemia. Diarrhea is another nursing problem, constipation, alteration in a nutritional status if they're not able to hold on to it long enough for their body to properly break it down and metabolize it. Depending on their output and their nutritional status, they're at risk for skin integrity. If they become severely dehydrated, their breathing pattern may be impacted. So just have an idea on what those more common nursing diagnoses will be. Hypovolemia risk is a big one, along with diarrhea and constipation. For care planning, there is an excellent resource. It goes in nursing analysis, goal, outcome, maintaining fluid balance. You're going to want to use these as references as you go forward with care planning and anticipating needs for a patient. And get caught up as usual. I'm just flying through and not catching my slides up. So, what are some common medical treatments in the child with an elimination issue? So, you may see orders for hydration. That's one of the more common, especially if they've had diarrhea or poor fluid intake, or they have an issue that is creating an excessive fluid loss. So hydration is important, as well as providing adequate nutrition through oral, enteral, meaning a gastrointestinal, either a nasogastro tube, a percutaneous enteric tube, an orogastro tube, but it allows fluid and nutrition to be deposited into the gastrointestinal tract, or IV. Enemas, bowel preparations, the enemas quickly absorbed, depending on what the desired outcome, to vacate the rectum, the bowel. Enemas are an effective way of accomplishing that. When the bowel, the intestines, small or large, need a rest or they've become damaged, a surgical intervention may be what's called an ostomy. An ostomy is when there's an opening into the digestive organ and the opening is pulled to the surface. A colostomy happens in the colon or the large intestine. An ileostomy happens in the small intestine. So when I say hydration is one of the first areas, oral rehydration, typical Pedialyte, Infolite, Rhisolite, things that are not to be used for oral rehydration would be tap water, milk, an undiluted fruit juice, so very sugary, soup or broth. You want to have something that has an appropriate amount of electrolytes in it. So oral hydration is typically ordered for mild to moderate dehydration, and you will try to get 50 to 100 milliliters per kilogram of the oral rehydration solution into the child over a 4-hour period of time.